It's common for many people to suddenly find out they need dialysis. Because of this, most will start their treatments using a catheter. This education will explain what a catheter is, why it is temporary, and how you can replace it with a permanent solution. What is a dialysis access? As you may already know, the dialysis machine acts like an artificial kidney by removing waste and extra fluid from your blood. Your access is the place in your body where the blood leaves to enter the dialysis machine and returns when cleaned. To connect your bloodstream to the dialysis machine, you need a port in your body. We call this an access. Your dialysis access, sometimes referred to as a vascular access, allows for your blood to travel through the machine where waste and extra fluid are removed before returning back to you. During your treatment, your blood can circulate through the machine up to 20 times. And the more your blood is circulated, the more waste and fluid is removed. What is a temporary access? Most people don't know that their kidneys are failing until they need dialysis. Due to this, many get a temporary access placed in their chest at the hospital. This is called a catheter. About 4 out of every 5 patients begin their treatments using a catheter to connect them to the dialysis machine. Typically, a catheter is placed in a patient's chest in the hospital as a short-term solution for emergency kidney failure. This allows for dialysis to begin almost immediately. Why are catheters considered temporary? Catheters are considered a temporary solution because of the high risk of life-threatening infections. You should know the risk for a bloodstream infection is 5 times greater with a catheter. On average, people with catheters may spend more than 30 days per year in the hospital from complications with the catheter. Catheters cause about 37,000 painful bloodstream infections every year. To avoid these dangers, your kidney doctor may recommend removing the catheter and replacing it with a permanent access, like a fistula or graft. We recommend working with your doctor to evaluate making the change from a temporary to a permanent access right away to limit the amount of time you spend with a catheter. Changing to a permanent access. For hemodialysis, there are 2 options for a permanent access. The first and most highly recommended is called a fistula. A fistula is created when a surgeon connects an artery to a vein, typically in your arm. Over time, the vein thickens, allowing for greater blood flow, which means better dialysis. The second option, called a graft, is a small tube placed under the skin and used to connect an artery to a vein. Permanent access options take time to place and heal before they are ready to use for dialysis. This is why making arrangements with your doctor to remove the catheter should happen right away. It starts with the first step. Talk with your doctor about the permanent access options. Remember, this is not a commitment to go forward with surgery. This is simply a way for you and your doctor to determine if a permanent access, and what kind, is right for you. Working with your doctor to decide if a permanent access is a better choice for you will ultimately put you on a path to a healthier future.